my name's Kendra, and today I'll be giving you discharge instructions for a cat spay and a cystotomy. Let's begin with some cat spay discharge feeding guidelines for a cat spay should be as follows. No food or water for the first 1 to 2 hours after getting home, and then after those 1 to 2 hours, you can begin to feed small amounts to them. They can begin their regular diet the following day as well as having water. You need to restrict their activity to inside to a clean, dry area for at least 10 to 14 days, and you want to confine them indoors. You want to check the incision site 3 times daily for any redness, swelling, odor, or discharge. And if you do notice either of those, please give us a call to make an appointment so that we can check out to make sure they don't have any brewing infection. If we aren't open, you can call your closest emergency animal hospital and you can be seen there. You also want to keep an e-collar on them at all times until your next recheck appointment in 2 weeks. You don't want them to self-harm themselves or excessively lick to cause infection. You also want to replace your clay litter with something that is non-clay, such as shredded paper, just so that the litter doesn't stick to the incision site, because that could also cause infection. You want to keep the non-litter in there for the next 10 to 14 days until you get the okay from a doctor or a text saying that she can go back to normal clay litter. You also want to give their medications as instructed on the label until they're gone, and we need to see your cat back in 10 to 14 days for a recheck exam. Here are the discharge instructions for a cystotomy. Feeding guidelines for a cystotomy after surgery would be no food for the first 1 to 2 hours after arriving home. Once they get home and they have settled in for the first 1 to 2 hours, they can have half the rations of their normal diet. They can continue their normal diet the following day. You want to confine them indoors to a nice, clean, dry area. No excessive exercise or strenuous walks. You don't want to tear the incision site open. You want to check the incision site 3 times a day. You want to observe for any redness, swelling, odor, or discharge. If you do notice any of those, please contact us immediately so that we can evaluate your pet. If we're not available, please contact your nearest emergency animal hospital so that they can make sure that everything's okay. You want to keep an e-collar on your pet just to make sure that they don't cause self-trauma. We don't want them licking or chewing out the sutures because that can cause infection. You want to also give the medication as directed on the bottle and give it until it's gone, unless directed otherwise. And a recheck exam is necessary in 10 to 14 days just to make sure that everything's healing properly. Some other special instructions for cystotomy is changing their diet as recommended by the veterinarian. You want to change them to a more either acidic or alkaline diet depending on what the results of the stones are that we observed in the bladder. You also want to observe for any excessive urination or straining. It's normal to see some blood in the urine for the first few days after the procedure, but if there's any obvious signs of it being more than just a little, please contact us or the emergency animal hospital to get them evaluated.